This video is intended for education and training of eye surgeons. Viewer discretion is advised. Hello friends, I am Dr. Nidhi Patwardhan and today I will be talking about thinking process for a hard cataract. Now rather than approaching it as a whole tower, let us divide it into a sequence of steps. And the most important step is to get an adequately large CCC, at least 5 to 5.5 mm rexus. Now in this case, as I tried to rotate, it did not rotate without hydro. So I tried doing gentle hydro dissection and then I tried rotating, but still it was not rotating. So I tried hydro dissection again, multiple points hydro dissection, gentle hydro dissection, and thought now it should rotate. Well, as I tried rotating, it was still not rotating. So I tried the bimanual technique of rotation to release these corticocapsular adhesions and also to decrease the stress on the zonules. Now the first step is done, and now the first most important step is to break the center. And my technique is stop and chop. I am working on a constellation machine. I am first making a half trench around 70 to 80% depth. It's important not to push on the nucleus. I am doing almost a vertical trench, a deep trench. I realized that the tip is small, exposed tip, so I have enlarged it and I enlarged the trench. After that, I go to the burst mode and I bury the whole tip inside, and then I aim for the division, separation up till the posterior plate. So you can notice after the burying, your chopper or Sinski should go below so that to ensure that the center is fully separated. Now to divide the pieces, again the same step is followed, that the tip should be buried whole, 1 mm tip should be buried as a whole, and the left hand should be moving continuously from up to down to ensure the separation up to the posterior plate. It requires a lot of patience, but we have to repeat this step for all the pieces. Our aim is to get multiple pieces, at least 6 well separated pieces will make the job very easy. So you can see the movement of the left hand. It is moving progressively down and towards the center to ensure the separation. Ensure to replenish the viscoelastic in between, and you can see after this step of separation of pieces is repeated multiple times. After the pieces are well separated, the next step becomes very easy if the pieces are well separated. Only thing you have to do is to keep the bevel down and then take all the pieces and eat them in the safe zone of central 3 mm zone. Keeping the bevel downwards not only helps to keep the endothelium safe, but also helps in approaching the nucleus from the anterior half. You can see that mainly it is the left hand which is doing the work, and it is keeping the nuclear pieces below the bevel. Also you can notice the level of doing phaco. The piece is almost half inside the bag, and I feel this is one of the most important factors determining the clarity of cornea after the surgery. So even if you are doing a NS1 grade cataract or a NS5 grade cataract, I feel the level of nucleus emulsification should not be above the iris plane at least. As you can see, I am doing the phaco only in the central safe zone. I have reduced the vacuum for the last piece, and my right hand is not moving at all, and it is staying exactly in the center. For bringing all the pieces in front of the phaco probe, I am moving my left hand. For the last piece, I have reduced the vacuum to 280 mm of mercury. This is in a Venturi mode machine. Keep a watch on the posterior capsule. If there are any fluctuations, you can decrease the vacuum further. It is important to keep the phaco probe steady in the center and not move it around searching for pieces, because it increases the fluctuations in the chamber and can increase the risk of posterior capsular rent. The rest of the case is completed routinely, and the patient is examined 3 hours after the cataract surgery. I believe all of us can achieve good outcomes if we follow the basics of doing a hard cataract. Thank you for your patience.